Medical Dispatch is a digital broadcasting program designed to give you general medical information and is not medical advice. Please consult your personal medical team for any medical advice. Medical Dispatch is for informational use only. Medical Dispatch can be heard only on the USA EBN Digital Broadcasting Network. www.usaebn.org. The physical effects of depression on the body. Introduction. Introduction to depression. Serious mental health condition. Affects millions worldwide. Emotional and psychological symptoms. Primarily recognized for these symptoms. Physical manifestations. Range from mild discomfort to severe health complications. Impact on bodily functions and health. Explores various ways depression affects the body. Depression is a serious mental health condition affecting millions globally. While known for emotional symptoms, it also has significant physical effects, ranging from mild discomfort to severe health issues. This report explores how depression impacts bodily functions and overall health. Changes in brain structure and neurotransmitters. Changes in brain structure and neurotransmitters. Depression alters neurotransmitter levels. Serotonin, dopamine, and norepinephrine are particularly affected. These neurotransmitters regulate mood, pain perception, and brain function. Impact on brain regions. MRI studies show prolonged depression can shrink the hippocampus. Hippocampus is responsible for memory and learning. Prefrontal cortex may also be affected. Prefrontal cortex controls decision-making and emotional regulation. Leads to cognitive impairments. Depression impacts neurotransmitter levels, affecting serotonin, dopamine, and norepinephrine. MRI studies reveal prolonged depression can shrink the hippocampus, affecting memory and learning. The prefrontal cortex, responsible for decision-making and emotional regulation, may also be impaired, leading to cognitive issues. Chronic pain and sensory processing. Depression and pain sensitivity. Increased levels of pro-inflammatory cytokines. Conditions like fibromyalgia and chronic fatigue syndrome. Common pain reports. Headaches, muscle pain, joint pain, back pain, often without a clear physical cause. Depression can increase pain sensitivity due to higher levels of pro-inflammatory cytokines, leading to conditions like fibromyalgia. Many individuals report headaches, muscle, joint, and back pain, often without a clear physical cause. Increased risk of heart disease. Increased risk of heart disease. Depression is linked to high blood pressure, inflammation, and elevated stress hormones. These factors increase the risk of heart attacks and strokes. Unhealthy habits. Depressed individuals are more likely to smoke, have a poor diet, and lack exercise. These habits further exacerbate heart problems. A depression increases the risk of heart disease by causing high blood pressure, inflammation, and elevated stress hormones. Additionally, unhealthy habits like smoking, poor diet, and lack of exercise in depressed individuals further worsen heart problems. Irregular heartbeat and palpitations. Autonomic nervous system dysregulation. Caused by depression. Leads to irregular heart rhythms, arrhythmias. High levels of stress hormones. Trigger tachycardia, rapid heartbeat. Cause chest discomfort. Depression can cause autonomic nervous system dysregulation, leading to irregular heart rhythms. High stress hormone levels can trigger rapid heartbeat and chest discomfort. Gastrointestinal disorders. Disruption of gut-brain axis. Conditions like irritable bowel syndrome, IBS. Constipation and diarrhea. Acid reflux. Appetite changes. Weight loss. Weight gain. A depression affects the digestive system by disrupting the gut-brain axis, leading to IBS, constipation, diarrhea, and acid reflux. It also causes appetite changes, resulting in weight loss or gain. Nutrient deficiencies. Impact of poor eating habits on nutrient levels. Associated with depression. Leads to deficiencies in essential nutrients. Key nutrients affected. Vitamin D. B vitamins. Omega-3 fatty acids. Magnesium. Consequences of deficiencies. Worsens mood. Lowers energy levels. Poor eating habits linked to depression can cause deficiencies in essential nutrients such as vitamin D, B vitamins, omega-3 fatty acids, and magnesium. These deficiencies can further deteriorate mood and energy levels. Immune system. Weakened immune response. Depression increases inflammatory markers. Higher susceptibility to infections, colds, and autoimmune disorders. Chronic stress and depression effects. Slows down wound healing. Increases risk of chronic illnesses like diabetes and arthritis. A depression weakens the immune system by increasing inflammatory markers, making individuals more prone to infections and autoimmune disorders. Chronic stress and depression can also slow wound healing and raise the risk of chronic illnesses like diabetes and arthritis. Cortisol dysregulation, stress hormone. Cortisol dysregulation, stress hormone. Depression leads to excessive cortisol release. Causes weight gain, especially in the abdomen. Leads to high blood pressure. Causes insulin resistance. Prolonged exposure can lead to osteoporosis. Weakens bones over time. A depression causes excessive cortisol release, leading to weight gain, high blood pressure, and insulin resistance. Prolonged exposure can result in osteoporosis, weakening bones over time. Thyroid dysfunction. Hypothyroidism and depression. Insufficient hormone production by the thyroid gland. Leads to symptoms such as fatigue, weight gain, and brain fog. A hypothyroidism, a condition where the thyroid gland produces insufficient hormones, is linked to depression. This condition leads to symptoms such as fatigue, weight gain, and brain fog. Musculoskeletal system. Muscle weakness. Chronic depression can cause muscle tension. Fatigue and weakness make daily tasks harder. Joint pain. Increased inflammation contributes to joint pain. Stiffness, sometimes mistaken for arthritis. A depression can lead to muscle tension, fatigue, and weakness, making daily tasks difficult. It also increases inflammation, causing joint pain and stiffness, often mistaken for arthritis. Insomnia and poor sleep quality. Insomnia and poor sleep quality. Difficulty falling asleep. Difficulty staying asleep. Waking up too early. Effects of poor sleep quality. Affects cognitive function. Impacts mood negatively. Reduces overall energy levels. A depression often causes insomnia, making it hard to fall or stay asleep, or waking up too early. Poor sleep quality impacts cognitive function, mood, and energy levels. Excessive sleeping, hypersomnia. Hypersomnia and depression leads to excessive fatigue. Results in low motivation. Hypersomnia and depression can lead to excessive fatigue and low motivation, impacting daily life. Decreased libido and sexual dysfunction. Decreased libido and sexual dysfunction. Depression can lower testosterone and estrogen levels. Reduced sexual desire and performance. Impact of antidepressants. SSRIs and SNRIs may contribute to erectile dysfunction, delayed orgasm, and reduced pleasure. A depression can lower testosterone and estrogen levels, reducing sexual desire and performance. Antidepressants like SSRIs and SNRIs may further contribute to erectile dysfunction, delayed orgasm, and reduced pleasure. Menstrual irregularities. Irregular periods. Depression can cause hormonal imbalances. Leads to irregular menstrual cycles. A worsened PMS symptoms. Increased severity of premenstrual symptoms. Linked to hormonal changes due to depression. Severe menstrual pain. Hormonal imbalances can cause more intense menstrual cramps. Depression exacerbates the pain. A depression in women can lead to hormonal imbalances, resulting in irregular periods, worsened PMS symptoms, and severe menstrual pain. Skin and hair health. Skin conditions. Depression can cause or worsen psoriasis. Can lead to alopecia. May exacerbate acne. Can worsen eczema. Hair health. Increased stress hormones. Leads to excessive hair shedding. Causes hair thinning. Depression can negatively impact skin and hair health. It can worsen conditions like psoriasis, alopecia, acne, and eczema. Increased stress hormones may lead to excessive hair shedding and thinning. Conclusion. Significant impact on physical health. Weakens the immune system. Increases risk of chronic diseases. Importance of early intervention. Proper medical care. Therapy. Lifestyle changes. Improvement of overall well-being. Mitigating effects of depression. Depression affects not only mental but also physical health. It weakens the immune system and raises the risk of chronic diseases. Early intervention, medical care, therapy, and lifestyle changes can help mitigate these effects and improve overall well-being. Thank you for listening to this medical dispatch. Remember, Medical Dispatch is a digital broadcasting program designed to give you general medical information on current events and is not medical advice. Please consult your personal medical team for any medical advice. Medical Dispatch is for informational use only. Medical Dispatch can be heard only on the USA EBN Digital Broadcasting Network. www.usaebn.org